know we're going to sedate the horse, but they don't necessarily understand what all that encompasses as far as how it affects the horse. So a lot of times, especially in the spring, we'll come out to places where we've set up appointments and there's horses that are struggling with respiratory issues such as heaves, and we can't sedate them, or we choose not to sedate them for their own health at that point. And sometimes that's hard for people to understand at first, but the sedation actually depresses the respiratory and cardiovascular system, so we don't want to take a horse that's already compromised some way and then sedate them and cause problems. This is an elective procedure. We don't want the horses to be hurt when we're trying to help them, and it's also not worth risking their health for something that's not an emergency. Can you see her at all in here, that she's pretty much just like, whatever, I don't care. People are always just kind of amazed, and you have other video of that. They just hang their heads here. Some of them fuss around, but people are always so convinced it's going to be a disaster. Really, it just amazes me every day, every horse, how well that most of them take this. Yes, they're sedated, but if she didn't want to stand here, she could throw her head to the back up, throw her head around. Some of them chew pretty hard on the speculum, but they really handle this pretty well. Some of them are pretty scared about it, and it takes a little bit of time to settle them down. That's just kind of training, teaching them they don't have to be scared.